Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editor's highlights and a summary of our open access publications available to everyone.
The October issue of the journal highlights key advances in oncodermatology. Artificial intelligence-enhanced dermoscopy and reflectance, confocal microscopy are improving skin cancer diagnostics. New e-learning methods are making optical coherence, tomography images easier to interpret. In melanoma, the neutrophil-to-lymphocyte ratio is gaining attention as an accessible biomarker. Integrated models that combine clinical, molecular, and immune data may improve prognostic accuracy. Dupilumab also shows promise as a steroid-sparing therapy for difficult cutaneous immune-related adverse events, allowing safer continuation of immunotherapy.
In an opinion piece, Umar and Tasduk shed light on photophagy in the context of ultraviolet B-induced skin aging. Light-induced autophagy, or photophagy, is an adaptive cellular mechanism triggered by UVB radiation that helps maintain skin homeostasis by clearing damaged proteins and organelles, though its role in photodamage is not yet fully understood. This process plays a dual role, protecting against acute UV-induced damage while potentially contributing to photoaging and carcinogenesis when dysregulated. Emerging evidence suggests light-induced autophagy may intersect with planar cell polarity pathways, which are crucial for skin structure and repair, raising questions about whether it aids in restoration or worsens UV-induced disruption. While light-induced autophagy shows promise as a therapeutic target for skin protection and repair, further research is needed to clarify its complex, context-dependent functions and optimize its modulation for safe and effective treatments.
Soto Moreno et al. Return with an open-access review on the microbiome in hidradenitis suppurativa tunnels. HS is a chronic inflammatory disease that affects the pilosebaceous units, particularly in large skin folds. The pathophysiology of HS is multifactorial, with evidence suggesting that the microbiome plays a crucial role in perpetuating inflammation. The persistent nature of HS tunnels, coupled with potential dysbiosis in these lesions, may help explain the recurrent episodes of HS, even with systemic treatment. To explore this further, the authors conducted a literature search on June 20, 2024. A total of 8 studies involving 418 patients, 632 HS lesions, 360 HS tunnels, and 300 controls were included. The findings from these studies suggested that HS tunnels are characterized by a polymicrobial microbiome, predominantly dominated by anaerobic bacteria such as Porphyromonas, Parvomonas, Fusobacterium, and Prevotella. In contrast, HS tunnels exhibit a notable reduction in saprophytic species like Cutibacterium acnes and Staphylococcus epidermidis, which are commonly found in healthy skin. Disease stage, as classified by the Hurley system, is the most significant factor influencing the microbiome composition of HS tunnels, with advanced lesions showing a greater presence of dysbiotic and pathogenic flora. Interestingly, no significant differences in bacterial colonization were observed based on variables such as sex, age, smoking status, body mass index, or anatomical location. Larger biofilms with active bacteria were found in tunnels and anaerobic regions of hair follicles. Overall, these results highlight the distinct polymicrobial, predominantly anaerobic bacterial flora of HS tunnels and the significant reduction in commensal bacteria typically found in healthy skin. This specific microbiome may help explain both the pathogenic characteristics and therapeutic challenges associated with HS tunnels.
In another review, Varga et al. Discussed the diagnostic accuracy of novel optical imaging techniques for melanoma detection. The incidence of melanoma is increasing worldwide, requiring early detection to improve survival rates. Although dermoscopy is the standard non-invasive tool for diagnosing melanoma, it relies on experience and skill. Advances in optical imaging technologies and artificial intelligence have the potential to improve diagnostic accuracy. Our objective was to compare the diagnostic accuracy of novel, non-invasive optical imaging techniques for melanoma detection. A systematic literature search was conducted in 3 databases on November 15, 2023. Inclusion criteria focused on studies comparing the accuracy of optical imaging methods against histopathology. Outcomes consisted of measures of diagnostic accuracy. Random effects meta-analyses were performed for each method, with 95% confidence intervals to summarize all relevant effect sizes. Of the 16,239 records, 141 articles met the inclusion criteria, of which 138 articles were eligible for the meta-analysis. Reflectance confocal microscopy, or RCM, and dermoscopy, combined with artificial intelligence, in short, DSC plus AI, had the highest sensitivity, with DSC plus AI showing higher specificity than RCM. Multispectral imaging combined with AI also showed high sensitivity and relatively high specificity. Standalone dermoscopy exhibited balanced sensitivity and specificity. In melanoma diagnosis, both RCM and DSC plus AI can serve as second-step optical evaluation methods for suspicious lesions following initial screening with DSC. By maintaining a strong emphasis on multimodal imaging, healthcare providers could improve early detection and outcomes for patients with melanoma.
Further in this month's issue, Cumprensiotis et al. Contributed with a review on Dupilumab for the treatment of cutaneous immune-related adverse events. The emergence of immune checkpoint inhibitors has revolutionized the landscape of cancer treatment in the modern era. However, cutaneous immune-related adverse events are common, significantly affecting patients' quality of life and often leading to treatment discontinuation, which may compromise oncological outcomes. Dupilumab, an immunoglobulin G4 human monoclonal antibody targeting interleukin-4 and interleukin-13 receptors, is widely used for dermatologic conditions, but remains unapproved for cutaneous immune-related adverse events due to the limited and scattered supporting evidence. This review summarized the available evidence regarding the use of Dupilumab for the management of cutaneous immune-related adverse events. In total, 25 publications met the eligibility criteria and were included, reporting 136 patients who were diagnosed with 140 cutaneous immune-related adverse events and were treated with Dupilumab. The most frequent adverse effects were eczematous rashes, bullous pemphigoid, and maculopapular or morbilliform rashes. Dupilumab was found to be highly effective, with most patients achieving complete or partial responses, even when affected by two concomitant cutaneous immune-related adverse events. An acceptable safety profile was demonstrated regarding both adverse events and oncological safety, with no additional concerns to be raised. The findings may be encouraging, but are limited by the relatively small number of patients treated and the nature of the included studies, with most of them being case reports and case series. More research is warranted, along with more clinical studies, perspective and design, focused on relevant clinical outcomes of this Dupilumab-treated subset of patients.
A research paper by Ko et al. Centered on the role of Staphylococcus aureus nasal carriage in hemodialysis patients. While S. aureus is a well-recognized concern in hemodialysis patients, its role in uremic pruritus remains unknown. This study investigated the impact of S. aureus nasal carriage on the prevalence and severity of uremic pruritus and its association with subsequent infection in HD patients. The authors conducted a prospective cohort study from April 2019 to January 2020, enrolling 100 HD patients in Taiwan. Nasal swab cultures determined S. aureus colonization status. Odds ratios for uremic pruritus, effect estimates for pruritus intensity, and hazard ratios for subsequent S. aureus infections were assessed. S. aureus nasal carriage was detected in 24% of HD patients and was more prevalent among those with uremic pruritus. S. aureus nasal carriage was associated with a significantly increased risk of uremic pruritus and correlated with higher pruritus. During a median follow-up of 8.97 months, 5 patients developed S. aureus infections. While S. aureus nasal carriage showed a trend toward an increased risk of subsequent infection, the finding did not reach statistical significance. S. aureus nasal carriage is significantly associated with the prevalence and severity of uremic pruritus in HD patients. Larger studies are needed to confirm its role in infection risk and to explore decolonization as a potential therapeutic strategy.
Featured in the current issue is also an original article by Pasek et al. On prognostic biomarkers for anti-PD-1 antibodies in the first-line treatment of advanced melanoma. Approximately 50% of patients with advanced melanoma treated with first-line anti-PD-1 immunotherapy achieve clinical benefit. However, to date, there are no validated biomarkers for objective response, progression-free survival, or overall survival with this treatment. The authors performed a unicentric retrospective analysis of ORR, PFS, and OS in 138 patients with advanced melanoma treated with first-line anti-PD-1 monoclonal antibodies. Baseline blood parameters were analyzed as potential predictive or prognostic biomarkers. ORR was assessed using both RECIST version 1.1 and IRECIST. Survival analysis was performed using Kaplan-Meier curves, and comparisons were made using the log-rank test. Multivariate Cox regression analysis was used to determine independent prognostic factors for survival, and a logistic regression model was used for response. The median follow-up was 44.1 months. Elevated pretreatment LDH level and SII were negative prognostic factors for PFS. However, only LDH remained statistically significant on multivariate analysis. Increased pretreatment LDH level and SII were both negative prognostic factors for OS on multivariate analysis. Elevated pretreatment levels of SII and LDH were shown to be independent negative prognostic factors for OS. According to the nomogram for OS, which considers a combination of pretreatment parameters including LDH and SII, it is possible to predict 24-month OS in the first line of anti-PD-1 therapy.
An observational cohort study by Wolfsweg et al. Focused on CUSUM integrated e-learning for differentiation between basal cell carcinoma, or BCC, and non-BCC lesions on optical coherence tomography. The clinical implementation of optical coherence tomography, or OCT, for diagnosing clinically equivocal lesions, suspicious for basal cell carcinoma, is limited by an OCT assessor shortage. Cumulative sum analysis enables the monitoring of diagnostic performance during training. The objective was to evaluate whether CUSUM integrated e-learning is suitable for training healthcare professionals in achieving and maintaining an acceptable error rate for differentiating BCC from non-BCC lesions on OCT. Furthermore, we explored the diagnostic accuracy of high-confidence BCC diagnoses by the newly trained assessors. A CUSUM integrated e-learning was developed. Trainee performance was monitored by CUSUM analysis. The number of OCT scans required to achieve and maintain a predefined acceptable error rate was evaluated. Successfully trained assessors were asked to discriminate BCC from non-BCC on 100 OCT scans for a subsequent diagnostic accuracy study. Histopathology served as the reference standard. 17 trainees successfully completed the training. Adequate performance was achieved and maintained after assessing a median of 385 scans. The pooled area under the curve as a measure for the ability to differentiate BCC from non-BCC lesions was 0.852. Pooled specificity and sensitivity for a high-confidence diagnosis were 95.4% and 31.1% respectively. CUSUM integrated e-learning was successfully applied to train healthcare professionals to differentiate BCC from non-BCC on OCT. Trainees achieved a diagnostic accuracy suitable to start using OCT in clinical practice. This method can be applied to overcome the OCT assessor shortage and for training other medical skills.
Torgman, Shankman, and Morrison published a short communication on the causes of monodactylous onycholysis in a diverse patient population. Monodactylous onycholysis, or nail separation affecting a single digit, can signal a range of conditions, including subungual malignancy, and often requires biopsy for diagnosis. In this largest study to date, monodactylous onycholysis was most commonly associated with verruca vulgaris, psoriasiform dermatitis, and retronychia, with notable cases of subungual squamous cell carcinoma, especially in the great toes and thumbs. The study highlights diagnostic trends in a predominantly Hispanic/Latino cohort, emphasizing the need for early recognition, especially in underrepresented populations, and suggesting that mechanical and occupational factors may influence monodactylous onycholysis localization.
Concluding this month's episode, another short communication by Bustani et al. Compared the diagnostic performance of GPT-4o and Gemini Flash 2.0 in acne and rosacea. This study assessed the diagnostic performance of the two systems on clinical images of acne and rosacea, finding that GPT-4o achieved high accuracy in primary diagnosis, 93%, but only moderate accuracy in subtyping, while Gemini failed to provide diagnoses in most cases. GPT-4o showed strong sensitivity and specificity for distinguishing acne and rosacea, though subtyping performance was inconsistent, especially for less common variants. These results highlight the promise and limitations of LLMs in dermatology and underscore the importance of further validation before clinical use, especially as patients increasingly turn to AI tools for self-diagnosis.
This was the October episode of IJD in Focus. Thank you for listening. Until next time.